Yesterday, how excited I was personally. Dr. Bergeson is the most prolific inventor of our time.
Check it out. Let's do it. And so we took, this course was 3 days, and I was saying the courses we usually take, they're 1 to 2 days. And so we couldn't figure out what we were going to learn in 3 days, how much knowledge we were going to gain.
Well, for Dr. Darnell to be able to close our office enough because she's so passionate, and just being able to see different things that can help our families and our children and her staff, to educate them on Healthy Start. For me, I mean, it's a blessing. I mean, it really is, because if she hadn't let us come here, I wouldn't know this to be able to change my own children's lives.
And I want to put on there that this is the class we took within our company. We do that a lot amongst managers and practice administrators. If you have a good idea, you send it to all email accounts. When I mean all email accounts, it's 756 offices.
And then if you were to consider the quality of lecture, the content obviously is tremendous. How about the ability to convey the message?
Well, Dr. Jill is amazing.
Amazing.
We love her.
We love
And,
her. We did not fall
It's a
asleep
great
in class.
question. Dr. Bergeson treated this child and was able to improve their math and reading scores. Took them from a failing student to a thriving student.
And even Dr. Darnell was like, this is the best class I have been to. I've learned so much. I was on the edge of my seat listening to her, and Dr. Bergeson too. I mean, he's
hilarious.
He's adorable. I mean, you can't, yes.
He is not of the
We love
old
him.
school,
No, he's
good old
not.
boys club. He is a very progressive, and people probably looked at him like he is cuckoo.
Is within the confines of this slot, it's going to guide that tooth into position. So it's important that we have slots for every tooth. See those little bumps? So you push your tongue against that, and that will widen your palate. And that little shelf down here, see that little shelf there? You want to make sure your tongue sticks above that. And these little pokers are to remind your tongue not to come forward.
I think if you were telling other people like you whether or not they should take this class, what would you say?
I've already told my friends
Yeah.
they should take this class.
Yeah.
I was on
But in the
Facebook
first
during
hour
it
that
saying
we
you
were in
should take this class.
Our doctor, with Dr. Darnell, and it was not even an hour when we were in the class, she says, everybody needs
should
to
have
attend
brought
this
the
class.
team.
We should have brought our whole team, which we are now waiting for y'all to do in Atlanta, so where we can have our team come. All of our Heartland, hopefully will be there, because this is something that they definitely need
I
to
contacted
come in and
one of my
see.
old instructors who works in public health. So she has a direct access line to children of all levels. And I said, have you ever heard of this? And I said, look at the website. She's like, no, but it sounds interesting. Who's doing this up here? I said, we are. And she is very preventive. Let's do this. Yeah. Just spreading the word. And the people she's been doing it for 40 years.
Not
the
just
contacts
dentists,
that
but
she
ENTs.
has. Exactly, yes.
ENT pediatricians, everybody needs to attend this
Everybody.
class, because it could only benefit them, benefit their patients, doing what's best for their patients. Because like we were, talking about earlier, is at the end of the day, what do you do with the patients that,
Have no
at
success.
the ENT that had no success? Why not give them another solution? How much better would it make that pediatrician, that ENT look, if they have another solution to be able to help that child when, for them themselves, are at their end?
If that's their real goal, is to help that patient and nothing else, there are no finances, no predisposed notions of how things are supposed to work, then they will take the class.
Yes.
And they will go forward with it.
We've been using Orthotane. We just weren't educated enough to know what else Orthotane could do. So we have Orthotane in our office, and we thought we were doing it well. But when Jason came and showed us all the other things that Orthotane deals with, the whole list of symptoms, things that can help, and we were like, oh gosh, we think of all the missed opportunities of children that have come through.
Because literally she would stop breathing in spurts as she slept. I was exhausted. My wife was scared. We slept together in an upright position for the first 2 years of her life. You've seen a lot of these issues with mood disorders and swings, even at a 2-year-old's age. We took her to the pediatrician, we went to specialties, we had allergy tests done, we had an adenoids taken out, we had tonsils taken out, we had tubes put in, we had medications that she was on, at least 3 different kinds, and it seemed to clear up the problem for a moment, and then it came right back. And normally it came back a little bit more vicious.
We were straightening teeth, That's what we were doing.
Our front
Now,
office,
so, yeah.
Natalia,
Change lives,
was
yeah.
actually ended up in tears.
Yeah.
She was
She
just
was in
really upset
tears.
because she was the mom that stayed up all night holding her son because he laying him down to sleep.
As a baby.
He would wake up as a
he-
baby.
He stops breathing.
Yeah.
And she came to me a year ago, and she's like, maybe you know something. I'm like, it sounds like the baby's got sleep apnea, which I don't know about pediatric sleep apnea, but that's what it sounds like. His airway's collapsing. And then Jason comes along and talks to us, and we're all like, wait a minute. There's a mouthpiece that could possibly fix this problem for this infant,
And
She had
Years
2
old.
days later, she had an appointment.
Yes.
Even at 2 years old, you wouldn't think that a 2-year-old would be able to, put this mouthpiece in their mouth and keep it in their mouth. I was amazed because when we gave it to him, and we let him do it. We gave it to him and he popped it right in his mouth, and we were just made a big deal. He was all happy, good job, and he took it out, he put it right back in. So even at 2 years old, you think your 2-year-old cannot do it, but no problem.
And this is why the dentist is so important, because you're seeing these kids at a young age. That's the reason that sleep issues are so important for the dentist, because you're the one that sees patients on a regular basis from maybe 2 or 3 years of age on. And it's important to do all of this before they start school for sleep issues.
now knowing what you know, how would you feel about other parents not knowing this and they're letting their children be seen by a doctor or a practice that's uneducated to what Healthy Start is?
I see that every day.
Yeah.
You can almost know when people give up on something that they don't really know the answer. They say, well, you'll grow out of it. Oh, she'll get better. Give it 2 weeks. Add this medication with it, and I promise you, everything should work out. But when those things don't add up, and you start saying things to kind of cut yourself out of the picture because you don't know what's going on, I mean, that's sad and unfortunate.
But we were just uneducated and unaware of what was out there. But now that we are, it just makes us want to be able to go out there and have a seminar for parents around our communities just to come in.
I want to
and
go to the
explain them what we
pediatrician's
do.
office. I want to go to the
Yes,
orthodontist
ENT.
office.
Yeah.
Everybody, and just share it. If you take it, great. I'm not thinking a lot of orthodontists will, but
Why won't they? What's the
Good old
Financial.
boys club, they're at that and finances.
what kind of money do they have to make off that when they can stretch out traditional braces for so long, especially when insurance?
But
If
it-
that's their real goal,
Yeah.
is to help that patient
Right,
and
right.
nothing else, there are no finances.
What I've seen and what I've
Right.
experienced with my own daughter is that they were focused more on straightening her teeth.
And I was thinking about it, I was kind of upset, thinking, well, his mom and dad should have done more. No, they did what they were educated about what they did. They got the adenoids taken out. They had the child in speech therapy. They did everything they were told to do, and he's still a 46-year-old adult with all of these problems. So now we have to put Band-Aids on them, and it just breaks my heart.
The habits were never corrected.
No.
The teeth were straight.
Yeah.
But the habits were never corrected. And I think that's what orthodontists focus on more. I mean, after
Yeah.
learning what this can do, and that's a challenge that we definitely will be going back to our office and doing in our community. That's Dr. Yellow said.
So you guys are a learning environment.
Yes. Oh, yeah. My best friend's son just got diagnosed with ADHD, and the symptoms that I've learned while I've been here is everything he has. And one of my friends, she's not one that wants to put her son on medicine, and his mood swings have been going like this. I mean, it's been very, very, very hard.
It's an emotional roller
It is.
coaster, and they get to the point of what else can
You wear it at night and you exercise during the day. By the time you turn 11 in January, you'll have straight teeth and you won't have to have braces like CJ. How's that sound?
That sounds awesome.
I do? Even if they don't want to do medicine, they're willing to do almost anything. And then you
Anything.
have this, duh,
Now we have solutions.
try this. It's an affordable, easy. It's not going to mess anything up. What can go wrong? Just try it.
And I get passionate just talking about it, as you can see, because it works. It works. It's not the next thing on the block to be utilized and thrown away. This has been proven and it works, and it's changing people's lives.